I think it's appropriate to give a little introduction because we've got some new listeners. I'm Chuck Cora. Directly in front of me on my screen, plus about 360 miles away, is Big John Eisner. We are at Appalachia. Thank you so much for joining us. We're here to provide a counter-narrative to the stereotypes that plague Appalachia. We're also here to have a little bit of fun, too. John, typically intros start out with just us talking about something completely random, which is what we intend to do from here on out. But usually I think of something during the week and I can't remember it, and I've been getting better at writing stuff down. So I wrote down a list of 4 different things, and I want you to pick from those which one we're going to open the show with. So here we go. All right, this is the list. President's physical fitness test. Matt Gaetz versus Liz Cheney. J.D. Vance nativist bullshit. Or Bamboo Ninja.
Wow, man, I'm torn between 2. Because okay. I mean, obviously, like, we know J.D. Vance and we don't like him. We know that. So I'm like, maybe.
We're not breaking ground there.
But I do think we might break ground on 2 of the topics, which would be, did you say Bamboo Ninja?
Yes.
And President's physical fitness test, because I have a lot of feelings on that.
Okay, well, let's go to the physical fitness test, because I don't actually know much about the Bamboo Ninja thing, but I will look it up for the exclusive.
Yeah.
Plug the Patreon. There you go. Okay, so President's physical fitness test. I don't... hold on. Let me just adjust this a little bit. I'm trying to remember how this came up. I think it was because I was sent a meme about the V-sit.
Oh, yeah.
Which was where you had your legs spread open, you had your hands like crossed like this, and you had to like lean forward because somehow that was a test of physical strength, I guess. Let me back up, actually, for people that may not understand what the president's physical fitness test is. I don't know why the president had anything to do with it, but it was basically a physical fitness test that you had to do in elementary school, at least where we're from. And it was like a series of like 10 different things?
Yeah, it was a series, yeah.
And you could either get presidential level, which was the blue level, I guess, and then there was a red level, I don't remember what it was. National? I don't know. But I was terrible at every single thing except for the V sit and reach. Everything, like, there was pull-ups. I could not do a pull-up to save my life. There was sit-ups, push-ups, a mile run. God knows what else. I was terrible at all of it. But the V sit and reach, man, I was best in class.
about the sit and reach. So a lot of people may not know because they don't see us physically, but like Chuck, like I have a back
unless
condition.
You're watching on YouTube.
Well, they don't see my back though. So I've got kyphosis, which it's like makes my back do this and hunch over. I couldn't run a mile. I couldn't climb rope. I couldn't do a pull up. But my God, when it came to that, that's when the hunch really helped, because I was able. People are like standing straight up. I'm like, no, don't do that. Like, you don't need to. Allow those shoulders really to get in there. And I'm telling you, I'm past the amount that you can go. Like, I'm all the way. I had to have literally permanent marker drawn for me so that people could measure. But it did not matter, because as good as I was at that, everything else was terrible. So I never got anything.
Our stories are very similar.
Yeah.
It sounds like we're going to have a V sit and reach off next time we're in person. Because look, I that was the one thing in gym class I had confidence about. Literally the only thing that I felt good at.
Oh, well, see, that's where we're different. I had zero confidence in it because I just knew that it was going to show my hunchback more. So you could take it with confidence.
That's fair. I couldn't do a pull-up. I remember getting made fun of because like they either let you do a pull-up, or because I think so many of us were so unhealthy, instead of doing a pull-up, you were allowed to like hold it so that your chin was over top of the bar and hold yourself there. And apparently that counted, which those two physical things have nothing to do with each other, I'm convinced. But I could hang there for at least a little bit. I was very fat, though, so I fell pretty quickly.
Yeah, I used to So I had a coping mechanism with this in terms of how I would get around it. And the way I would get around it is I would just try to do things with one arm, because if I hung with one arm for even a second, I could go up to people and tell them I was stronger than them because they were doing it with two hands. It was also a coping mechanism because then I didn't have to admit that I couldn't hold my weight up. So that's how I got away with it.
Back to the president's physical fitness test. I think I'm going to start a campaign against it because it has the name president on it, which makes me assume that there's taxpayer money involved.
Oh, definitely.
And I don't want my taxes, especially from when I was a kid, my fat taxes, to be funding a program that is fucked up and reminded me of being fat.
I mean, that's fair.
That's just me. I don't know.
Did you know that, okay, Appalachia, but torn, but different, because I don't run it. You normally do it. But I want you to guess. I want you to guess the percentage of kids that fail that test.
Is this a real number that you pulled?
Yeah, real number.
Oh, okay. The amount of kids that fail. What's considered failing?
Okay, well, this, I think, maybe early on statistics, but like they used to pretty much do a pass fail, and I think that they still do. It's in you could have the people who are really high up, and then you have people who are at the pass rate, and then you have everybody else who fails.
Okay, 65.
You're really close. 58.
Oh shit, I was
58%.
Yeah. Okay.
And the history behind this test is not good. Like, it was created as just a terrible thing. I feel so validated now. Some believe that President Eisenhower may have created it because he wanted to get kids ready to go to war. Because
well, that would have been great for me because I was terrified. And I'm not, okay, this is a real story. I was horrified of being drafted into the Army.
Oh, yeah.
Because my mom told me about it when I was like 10, and she's like, if they call you up, you got to go. And I was like, what? What if you don't want to? And she's like, well, it's too fucking bad. And so until the day I turned, I think 26 or 27 years old, I was horrified of being drafted because that's the age at which you're phased out and you don't have to worry about it. But see, that's really good and that's really helpful because that would just tell me like you're too fat to fight.
I share that. I don't know if maybe that's a thing that a lot of kids go through, but I had the same thing. Like, I was afraid of being drafted, but I had like weird fears that they would get rid of the 18 requirement and just start drafting me right out of junior high. That was me.
But that was also your dream for the NBA.
Well, so. That's the other thing I was going to tell you. My mom my brother actually would be like, you'll probably get drafted one day. And I said, only to the NBA. So you have like little 260-pound me claiming that I'm going to go to the NBA. But in actuality, I was more likely to be drafted by the military.
Well, you got to admire the confidence there a little.
Point out real quick, Scouts. Since 2013, the test has been replaced. So I don't think you need to start a campaign.
Well, I don't like the word replaced, though. That implies that something is now taking its place.
Okay.
I don't know.
So it was replaced with a more comprehensive program that's supposed to emphasize one-size-fits-all regimen. So it's designed to be less humiliating.
Oh, so it's designed to not prepare kids for war. Great. That's a step up.
Is it? Or
I don't know. Probably not.
Or are we at,
eventually
we're like
now? If we're still in Afghanistan and it's been 20 fucking years basically, I don't really have much faith that I think we're going to have to start pulling people from wombs to get them to go.
You send me over, right? Okay. We're at war. We're about to go into a battle. I look around. I say, all right, boys, I'll take it from here. You should have seen me on the sit and reach. It literally had nothing to do with it. I don't understand why he picked the sit and reach.
Listen, I can fight Al-Qaeda. Have you seen me sit and reach? I can fight Al-Qaeda with that.
Climbing rope makes sense. Pull-ups makes sense. Push-ups makes sense. Sit and reach
for a gun to fight Al-Qaeda with. That's right, man.
I'm going to sit and reach for a donut if you're going to tell me that's physical activity.
Speaking of donuts and sitting and reaching, donuts are delicious, but John, you know what else is delicious? Is CBD gummies from cornbread hemp. How do you like that transfer right there, baby? Buy the CBD gummies. I know people that are listening to this, your inclination is to skip past this ad. I get that. I understand it. Bear with me. We're enjoyable people to listen to. Bear with me. The gummies are delicious. They are. I've had them. They are good. You will not regret it. They're always full spectrum. That means as much THC as the federal law will allow. We love that. We love that it's flower only, because why, John? Why do we love it?
Unlike Afro Man, we don't have to worry about picking out the seeds.
Unlike Afro Man and 99% of other CBD brands. So, I mean, a lot of them took after Afro Man, but cornbread hemp didn't, and you know. They're Kentucky's first USDA-certified organic CBD product. None of those bullshit preservatives and other nasty chemicals that will ruin your day and ruin your CBD. We don't like that, but you know what we do like, John? The satisfaction guarantee.
30-day money-back guarantee. It's free money on the table. They'll look. You could. Let's say you got a pack of 30. You ate them for 29. You say, I don't like these, Jim. Jim gives you your money back. What a deal.
You get a full refund. That's unbeatable, quite honestly. What else is unbeatable is it's family-owned. Look, on this show, we talk a lot about how important Appalachian businesses are and businesses from Appalachian states like Kentucky. This is a Kentucky business. It's family-owned. You're not going to find any of that corporate bullshit in there like all these other CBD brands. And in fact, John, get a massive promo code on this, and you get a huge discount. What is it going to be?
All you have to do is at the end, once your order is there, just type into the little coupon code, Appalachia. Really easy. APPODLACHIA, 25% off your order.
We got a great guest today, Dr. Sydnee McElroy. She is a medical doctor in the great city of Huntington, West Virginia, and she is extremely active in the harm reduction community there, working with the community on harm reduction methods, advocating for policy changes in West Virginia and throughout the country that focus more on harm reduction and destigmatizes the topic of harm reduction. Really excited to talk to her today. Also, important to point out, she is also a very, very well-known podcaster and co-host of the Sawbones podcast, A Marital Tour of Misguided Medicine, and Still Buffering, both on the Maximum Fun Network with the McElroy family of podcasting fame from the great city of Huntington, West Virginia. So very, very excited to have her on the show, and I know that you all will really love the conversation. Well, Dr. McElroy, thank you so much again for joining us. I wanted to start, we'll definitely get into a discussion about the recent legislation in West Virginia about harm reduction and syringe service programs. But I kind of first am interested in learning about a little bit more of like what harm reduction is, what that means to you, and why it's important to you as a medical professional.
Sure. I think that's a great question, because I think a lot of people tend to assume, well, first of all, when you say harm reduction, if you're not in this world, you might not know what we're talking about. And then secondly, they kind of reduce it to, oh, you mean a syringe exchange, and that's the end of it. So I think it's important to understand what harm reduction is as an entire concept, because we do harm reduction in our life all the time, especially like from a medical standpoint, from a wellness healthcare standpoint. Wearing your seatbelt is harm reduction. You know, we take part in risky behaviors and we try to do things to mitigate that risk. And that's at the heart of harm reduction. In my mind, it's no different than taking care of a patient who has COPD and still smokes. I'm not going to say, well, until you quit smoking, I won't give you any inhalers. I won't admit you to the hospital. I'll take care of you, encourage you. This would also help. And then when you're ready to take that step, I'm there for that too. Harm reduction is the same idea when applied to people who use injection drugs. So certainly part of that is what gets all the publicity, clean syringes, access to clean syringes. But the other part of it is talking about, with people who use injection drugs, they're the experts on it. So let's talk about how we keep you safe as a person and healthy and well while you're still engaging in these behaviors that, as a medical professional, my thought is are risky, are dangerous, and do have a lot of problems associated with them. How do I help keep you as healthy and safe as possible by providing you with all of the equipment that is necessary, by giving you resources, by giving you access to medical care? That's a big part of it is I work primarily with persons experiencing homelessness in our community here in Huntington. And so a lot of those patients do use injection drugs. And because they feel comfortable with me, I can not just talk to them about safe ways to use drugs, but also let's look at your skin. Let's see, do you have any infections right now? How are you feeling? Are you healthy? Have you been sleeping outside? Let's talk about health issues related to that. Are you safe? Are you being abused or threatened in any way? All of those things can be addressed as part of harm reduction. And then I think the other piece of it that is so important to our community and to public health as a whole is when we do all these things, we can reduce the transmission of bloodborne illnesses like HIV and hepatitis. We reduce infections like endocarditis, infection of the heart valves, and infections of the bones like osteomyelitis. All of these really serious the infections that consume lots of healthcare resources. And then hopefully this provides an opportunity for recovery for a lot more people. And we know that that's true, that kind of normalizing, like you're a human, you're a person, you're looking for help, you're looking for companionship, you're looking for friendship and understanding, and extending that hand is a way to help people take that step once they're ready.
Yeah, you make a lot of really great points there, especially with kind of deconstructing what it actually is, because like you mentioned, for people that are not familiar with the term, it's going to come off as foreign to them. And something that made me think of that too was what you mentioned in your op-ed from, I think, last month, where you talked about how syringe exchange or syringe service programs are an important conduit to people getting access to Narcan in order to reverse an opioid overdose. And I thought that was a really interesting segue to that. And I'm wondering if you can kind of explain the connection there and how things like syringe service programs can help fight the opioid crisis and help provide for people. Because it's something that I think a lot of people don't really know about. They hear syringe service program, they think injecting drugs, and that's kind of where it stops.
Mm-hmm. I think the piece of it, the Narcan or naloxone part of it, is really something that a lot of us were working during this past legislative session to try to talk to our representatives about the bill that was going to address syringe service programs and harm reduction programs in the state to try to make it better. And I wish there were so many things to focus on. I wish we would have talked about the naloxone part more, because I don't know that it occurred to people. Naloxone can reverse an opioid overdose. So it is a life-saving drug. It is the same idea as having an EpiPen available to someone who might have a severe allergy. It is absolutely life-saving. And so if we're in the business of trying to affirm life, trying to take care of people, keep people alive, give people the chance to survive, this illness that is addiction, this medical condition, and get to recovery, naloxone is absolutely essential. We know it is. In order to get naloxone, we do have in West Virginia a standing order, which means you don't need a prescription if you go to a pharmacy. You can get naloxone there without a prescription. Now, just because that exists doesn't mean it's really that easy. The people where you go, whatever pharmacy you use, they have to know that too. And I will tell you that is not always the easiest transaction. But you can go get it without a prescription. You could also have it prescribed to you by a medical provider, assuming that you're forthcoming about the fact that either you use injection drugs or someone you're close to does. Then you could get it from a provider. But I'll be honest, a lot of the clients that I work with, a lot of my patients, they get it from the shelter where I work, or they get it from the harm reduction program. Those are the main ways that people access that so that they can have it with them, because we know that is the key, is to not just have it in the hands of people in the hospital, not just have it in the hands of first responders. All those things are important, but we also need it in the hands of people in the community, people who are with those who use injection drugs and people who are using injection drugs. They're usually the ones administering it and saving each other's lives. And I am very worried that with this new legislation, it's going to be so much harder for them to access that in a really regular way.
An interesting thing that keeps coming up when we either talk about harm reduction or specifically here in West Virginia, one of the biggest arguments that people like to come up with is that harm reduction gives addicts or users an excuse to continue or a reason to continue abusing drugs. Obviously, you've stated like all these great benefits. What do you say to somebody, when they make that argument? Because I know senators are making it on the floor of the Senate in West Virginia. I mean, so what do you say to that?
I think the first thing is to acknowledge, I understand why you would think that. I mean, I think that's a really important thing in having these conversations. When I first had the idea introduced to me, my gut reaction was, well, isn't that kind of enabling? And a lot of people have that initial reaction. And that's why I think it's really important not to immediately, because at this point, I'm very emotionally invested in harm reduction, but not to have that emotional reaction and say, I understand why you might think that. But we have decades of data that says otherwise, because syringe service programs and harm reduction programs have existed since the 70s, really. They were a lot more prominent other places throughout the world, especially in the UK. There were lots of these programs long before they came to the United States. And what we actually know is that people who use injection drugs, people who have addiction, are going to use drugs whether the needles they have been used before, have been used by somebody else, or brand new out of the package. That's the way addiction works. So we can accept that as a reality and then say, wouldn't we rather, if they're going to use those drugs until they're ready for recovery, if they're going to use the drugs anyway, wouldn't we rather them be able to prevent the spread of HIV, prevent the spread of hepatitis, and prevent themselves from getting, I can't tell you how many patients I've cared for with these bacterial infections that you get from reusing needles or using a needle that wasn't cleaned properly that are just, they're horrible. They're painful. They're devastating. They require weeks of IV antibiotics. They require surgery quite often, extended hospital stays. It's a really horrific thing to see someone go through. And we can prevent all that by giving them these needles. They're not going to not use. They're just going to use an unclean needle.
Yeah, I used to always when people would say that to me. My dad was an addict when we were growing up, but he wasn't. He didn't inject anything. His big thing was like Oxy. He loved he'd pop them all the time. But I always said, it's funny because whether somebody was trying to help him or not, he wasn't. It was his decision to stop, and it wasn't going to make him do more or make him do less. It was his. He was always doing the same thing over and over again. So I wish that there would have been opportunities for harm reduction where we were living, because maybe that could have helped somehow. But in my opinion, I don't think it's a negative at all. I think, maybe there's a percentage chance that somebody fixes that or fixes themselves. The other argument that we hear, that this one is, I think, the hardest one maybe to get around, or it at least needs more publicity. There needs to be some type of message that corresponds to it. And that is, you have legislators now who are saying that harm reduction sends a bad message to our youth, essentially saying, we tell them that drugs are bad, but then we do these kind of things. And although I disagree with them, I haven't heard really anything from the other side to kind of go against that. Is there a message from those who support harm reduction?
I think that isn't something that I would say, at least that I have spent a lot of time talking about that specific part of it. But I would say a couple things to that. One, in part, I don't know that it would occur to me to address that specific issue because our kids know, they know this is a problem. They know their friends, their parents, their grandparents, their aunts, their uncles. I don't know anyone, myself included, I don't know anyone living in West Virginia who hasn't been touched by this in some way. So these kids are living it. They're seeing it. And I think these kids would prefer if they can have their parent, come back to them and be in recovery and have survived the illness that is addiction. they would choose that every time, I mean, so the message we're sending is your friends, your family, your parents, they matter to us. They matter to us as a society. They matter as people. They're worth something, which is a more powerful message in general. Not just these people that you might know or love or care about, but people matter. Individual humans matter and their lives matter. And to treat people with compassion and understanding and not just be punitive because you don't like something they did is a really, I mean, that's such a huge value to pass on to our children. It's something I try to instill in my children: forgiveness, compassion, there but for the grace of God I go, that kind of attitude. I mean, that, and I mean, I as a lifelong West Virginian, I don't know what's more West Virginian than that kind of approach to your fellow humans. Like that's how I was raised. So it speaks to me.
I wanted to pivot to the legislature and the governor, and among the, in my opinion, a lot of detestable things that they've done this year is that they took up and passed, and the governor signed SB 334, which was really put a lot of strict limitations on syringe service programs, and I think you mentioned it or referenced it at least to some extent in an episode of Sawbones that you did on harm reduction about how it's not effectively banning these programs, but it's essentially regulating them out of existence. Mm-hmm. And I'm wondering, from your perspective, as someone who both is involved in the community, but is also a healthcare provider, what's the real impact of this, and what burden is it going to place on the community and on healthcare providers?
In terms of individual programs throughout the state, I know there have been several who have come forward already and said ours will close under these new guidelines. We will not be able to achieve because what it is, it's a licensure program, which is, by the way, when you'll see a lot of people say it's the strictest in the nation. It's the most difficult legislation in terms of having a harm reduction program. It's because it requires that licensure, which no other state does. There are lots of other pieces of it that other states might require, but to do all of this and then attain a license to run a program, that's unique. And it takes another step, and it requires so many different levels of government to sign on to a letter to buy in, that it's going to be incredibly difficult for some programs throughout the state to meet all of those requirements, and some will close, certainly. I think I don't know. What the question we've all had is, will they close the 90 days after the bill was signed, or are they going to close when we have to apply for licensure, which I think is like in December? So, but there's been fear. I mean, we know some will close completely. But what the other effect, some specific issues with the bill, one is you have to have a state ID to use these harm reduction services. That's going to be, it's going to reduce their effectiveness. So it's not that the programs would close if that was the only stipulation. It's that a lot of people they don't have a state ID. I mean, again, with the community that I work with, it's incredibly rare for them to have an ID. And if they don't have one, they can't go. And so if you have a program that will serve the community, but only, a small fraction of it can actually access it, you're not going to see those big public health benefits. The people who can go still benefit, but you don't see the big things, the reduction of the spread of HIV, which is absolutely critical in Kanawha County and Cabell County, Kanawha, where they have the most concerning HIV outbreak in the country, and Cabell County, where we have our own HIV cluster. And I guarantee you, we are seeing the tip of the iceberg in our communities. The very tip. I think, unfortunately, there's a lot we don't know about already. And once all of the stipulations of this bill go into effect, it's going to get much worse. So I think all those things, some programs will close. Generally, they'll all become less effective because of these requirements. I don't know. My hope is that enough of us are passionate about it and can work together. I've actually been talking with people who work with harm reduction programs in several different parts of the state to try to come up with a coordinated effort to keep as many as possible alive and to keep resources going, throughout the state to try to coordinate to some extent. Because I feel like there are going to be places in the state where, right now, I don't know what Charleston's going to do. And that's where a lot of our, people who use injection drugs, people living with HIV, that's where they are. So I think it's a really concerning situation. I think in Cabell County, our program what I believe is we will stay open, but I think we'll probably serve a smaller percentage of the community and will be less effective, unfortunately.
Yeah, it's really shameful to see that and to think about it, because there's so many broad-reaching implications of just a bill like that. You think about all the people that go to those places for the resources, like we mentioned, especially about a naloxone that won't have that resource anymore. And you think about these communities. You mentioned the requirement for state ID. Really, interestingly enough, mirrors a lot of voter restriction laws in these countries as well, and it targets people who are of low income or experiencing homelessness, those types of things, and they're the ones that benefit the most from this. I'm kind of curious, and I don't know if you've had any conversations with lawmakers or maybe you've talked to people who have. There's obviously a huge stigma around syringe service programs and of the like. I'm wondering if that is a prevailing stigma within the people who are pushing this, because when I read up about some of the reasons and justifications for why they want to pass this bill, it's like, oh, well, we want to make things more safe, because this is this Wild West, unregulated needle exchanges. We're just here stepping in to take the little role of government to make things more safe. And that doesn't seem to be the case for me, but I'm just kind of wondering if the stigma of this, in your opinion, has an outside influence.
It absolutely has an outside influence, because the truth is, the programs we have in West Virginia, and I can't speak to every single one because I don't know all the ins and outs of every single one, but generally speaking, the ones that I'm familiar with, and especially a lot of ours are run out of health departments. These are not the Wild West of harm reduction programs. These are closely regulated, tightly run, monitored programs that already, a lot of the stipulations in the bill were that if you're going to have a harm reduction program, you have to provide recovery services, sure, access to things like that. You have to provide access to STI screening and treatment. And yeah, a lot of health departments do that. But like beyond that, things like you have to provide vaccinations and access to birth control and family planning and all that. We already do that. I mean, these programs do these things. So they were already very closely run, and in some ways already a little over-regulated because of a lot of local government action to try to tighten controls for these same sort of, stigmatized, fear-mongering kind of reasons, even a little more tightly than really we'd like to see. If you're talking from a pure CDC, like what would they recommend perspective, a good harm reduction program wouldn't even attempt to do a 1-to-1 needle exchange. You wouldn't use the word exchange. The idea is people come in, and when they need needles, you give them to them. That is a more effective program. We know that. We have the data to back it up. But we already were reducing that, that we were already tightening that to try to avoid this kind of situation. So what they're regulating was unnecessary to begin with. What they're going to do with this is just reduce the effectiveness. And a lot of the rhetoric that they would tell me when I would speak to some of my representatives and people who were concerned was, well, it increases crime. There's no data to back that up. There is no city in the U.S. where they had a harm reduction program and crime increased. There are some places where it goes down. There's some places where it stays the same. It doesn't go up. So that's a myth. The other thing is needle litter. That was the biggest thing. And all of the really overwrought emotional stories that people like to tell on the Senate floor and the House floor were of kids finding needles in the park. Which, by the way, I have 2 small kids. I'm raising them in Huntington. We've played in the park many times. I've never found a needle anywhere. I'm not saying it doesn't happen. I'm just saying, lived here my whole life, raising children here, never found one. But even if there were, there is no evidence that harm reduction programs increase the amount of needle litter in a community. The needle litter is there because we have people who use injection drugs, and because that's so terribly stigmatized, they're forced to live sort of on the outskirts of society and not interact consistently with medical care, with places to dispose of their syringes. Many of them don't have a home where they can, use and have a needle disposal, system and all those things. That is why that's happening. It has nothing to do with the harm reduction program. So eliminating them won't fix the needle litter. There was one study that suggested eliminating it might make it worse, but it certainly isn't going to improve it at all. So, and no matter how many times, I can't tell you, I've given this speech to people and written emails and made phone calls till I was blue in the face. And it just, I don't know, it just didn't seem to make a dent because people are so predisposed to believe drugs are bad, so people who do drugs are bad, and they end up doing bad things like throwing needles all over the ground and committing crimes in my community. And so it's just a not in my backyard attitude. Send them somewhere else.
It's easier to get votes with saying you stop needles in the playground than it is to say you helped people maybe become clean, which is really sad, and especially in a state like West Virginia. We actually should be honoring people that help people get clean, because it's an epidemic here. You mentioned this a little bit, but I guess maybe discussing what's the outlook here. I mean, so let's say a state like West Virginia, obviously Appalachia's all across Appalachia, we're seeing these types of issues. We're seeing that harm reduction in legislatures is constantly being shunned across the region. So what's the outlook if this bill obviously passed, it was signed into law, and let's say they close, we see a bunch of closures. What's the outlook for those communities?
I mean, I think, unfortunately, I would love to say that those of us who are involved with harm reduction and that have been anticipating and working to address this, I would love to say that, our whole plan will be we'll spring into action and we'll cover every deficiency and there'll be no effects felt. But I think that would be an overstatement. I think in communities where their programs close, they're going to see more morbidity related to IV drug use. So you'll see more patients overdosing and more deaths related to overdose. You're going to see more people admitted to the hospital with serious infections. Hepatitis C is a problem essentially everywhere where people are using injection drugs. So you're going to see more of that. But specifically in communities where we already see HIV, that's going to spread. And I think something that's really important to note is that even in places in the state where we don't have HIV outbreaks, if you have people who are using needles and sharing needles and you have hepatitis C there already, we know, just history tells us, statistics tell us, we will see HIV in those communities eventually as well. And we were saying that in Huntington. I mean, I have been practicing medicine here for a decade, and we were and training here for longer than that. We were saying that we would see an HIV outbreak here if we didn't do something long before it came. So these are predictable courses. We looked at Scott County, Indiana. We knew what could happen here. We didn't do enough to prevent it. And I don't mean everyone. Here in Huntington, Dr. Kilkenny, who runs our health department and our harm reduction program, is an amazing public health advocate, and he works his butt off. But we don't have enough of those people. We have some of them. We have some really hardworking, well-meaning, caring people who have the knowledge and the background and the drive, but there's never enough. And we saw HIV come, and it will spread to other parts of the state where these programs close, and people are going to lose people. That's the other part of it. It's all this idea that people who use drugs deserve punishment. That's really at the core of this. And these are our people, the people I take care of. I know a lot of them. I went to school with them. I know their families. Like I can't, they're not others. They're not from somewhere else. There are people, and we're going to lose more of them than we already have, which we've already lost more than, relatively than anyone else in the country.
Yeah. I think people miss that a lot, especially when it comes to, because obviously like drug use or anything illegal, people throw their hands up because, they do want punishment. You're right. And I think that for a lot of people, they forget that the end punishment for a lot of these people is death. And, obviously this is not, we can call it a crime all we want, but it's not a crime that should be punishable by death. And they should, you should have resources that can fix that. So I'm with you on that. Quick question. Are doctors, a lot of doctors, in agreement with you? Is the field split? I've not actually heard anything like how doctors feel about it.
The majority of healthcare professionals support harm reduction for the very, very basic reason. I think a lot of doctors can get kind of unemotional about, well, the science is there. The data's there. The evidence is there. I mean, that overwhelmingly there, and this is not a controversial area of medicine. There are controversial topics in medicine. This isn't one. This works. A lot of people might not want to be the one in the health department handing out the needle. I might be more unique in that respect. Like I enjoy this work. I enjoy being able to do this. But generally speaking, the medical community is united that, yeah, this is effective. It works. We should be doing it. Why are we regulating it at all? Like, why is the government getting involved in this area of healthcare? Because that's what it is. It's healthcare. It's providing treatment for a disease. And why did the government decide to stick its hands in this when there are so many other areas of healthcare where they trust our judgment and our science and our evidence to do the right thing?
Yep. All about those votes. I just always like to continue to bring it back there. So ultimately, we know now in a state like West Virginia, this bill is passed. This will go into effect. Jim Justice has signed it, and it'll go into effect in a lot of places around the Appalachia, I predict, because of how many bills are coming up. What do you think or people can do to help? I mean, I know that they're limited in some sense, but are there options for people that want to maybe either get involved or want to help with donation or anything like that?
I think so. In terms of donation I would say there's two different pieces to think about moving forward. The harm reduction programs themselves, when it comes to like actually handing out equipment that people will use to do drugs. So the needles and everything that comes with that. That piece of it is going to really have to be run by the program. So I don't know that there will be a lot of opportunity to donate specifically to that. But the naloxone piece, the Narcan part of it, that really is something people could do more for, because we can still hand out, and I'm part of groups that do that too, that just go around handing out Narcan, and we do it through fundraising. You can get some grant funding for it, but not huge grants. So we do that by raising money, getting Narcan, taking it out and giving it to the community. A lot of places, I know in Huntington, and I'm sure most places in West Virginia are the same, your local health department will probably teach you just check online or call. They'll have classes where you can learn how to use Narcan, administer it appropriately, and then give you some to carry with you. And I think that is maybe the most important thing. If there's one piece of all this, other than the understanding and the compassion and all that you can take away as an action, it would be that if you're not already certified to do that, look into it, because it takes no time. It's super. Narcan, especially now, we have the nasal sprays, not just the injections. There's the auto injector, which talks to you. It's a little thing that like it literally tells you what to do, like take the cap off, put it on their leg, hold still. I mean, it's super easy. You can learn how to do it. You can get the Narcan. You can carry it with you. You could save a life. And really, it's the same as having an EpiPen to save somebody's life if they get a bee sting or something. So I think that's a really powerful thing that people can do and pay attention to. There will be fundraising efforts around this without money to buy the exact equipment. There will definitely be fundraising efforts around this within your local community that I would look out for. And then the other thing is look for opportunities to volunteer and connect, especially with the community of marginalized people where you live. I know and understand and feel so much more in touch with all of this now because of my work at Harmony House in Huntington, because these are the people that I spend a good bit of my time with now. And once you do that, it's so hard, like the stigma, it's so much easier for it to fall away. All of that stuff that you were sort of, I don't want to say taught in school or at home or anywhere necessarily, but was kind of ingrained in us from society that people who use drugs were scary or bad. Spend a few weeks with them, because they're people. And sometimes they're making a decision that isn't the best for them and their health, but like, who doesn't? I mean, we all do. We all make decisions where I'm going to eat this big piece of cake, even though I know it's not good for me, or, or drinking. Drinking is a thing that a lot of people engage in to their own, sickness or discomfort or whatever. And we don't stigmatize those people the way we do injection drug users. So I would really encourage you to look for outreach opportunities, whether it's going and volunteering to feed people or going with an outreach committee to hand out like little care packages or hygiene bags in the streets. I guarantee you there are efforts like that in your community, and just engage with people, get to know them.
That's all really, really great advice. And I think especially encouraging people to challenge the presumption of how you view somebody who is a drug user, and emphasizing compassion over punishment, and starting to treat addiction like a disease and instead of a character flaw is something that's so important with just changing the narrative around that. And that's something that I know that John and I, when we started this podcast, we really wanted to focus on about stereotypes around the region. But even with something like this, where it's ingrained in you a certain mentality when you're young, it's so important to challenge that presumption and encourage others to do that as well. So I really appreciate you bringing it up. Dr. McElroy, thank you so much for coming on. We've been wanting to talk about harm reduction, I think, pretty much ever since we started this about 1.5 years ago. And I think that you were the perfect person to have on to discuss it, especially within this context. So again, we really appreciate it. And we know from other people we've talked to in Huntington, Cabell County, and around the area of all the important work that you're doing. And I know that it's really appreciated. So thank you so much.
Well, thank you both so much for inviting me. It was my pleasure to come and talk to you both. And I will always talk about harm reduction. So thank you.
That was our interview with Dr. Sydnee McElroy. John, your thoughts?
First off, I another big get, especially, and I'm not talking about the podcast side. I'm talking about the medical side because obviously everybody loves what they're doing. They have a ton of followers or whatever, but it's really what Sydnee's doing, during the day and helping all of these people that is the more impressive part to me. And I threw it in there because I wanted to know. I think there were 2 questions where I kind of played devil's advocate on what people would say outside, and I think people need to listen to what Sydnee's saying and use that in their everyday dialogue, because those are the type of answers that need to start being sent around in these communities so that we could start being more accepting and understanding what the real problems are, rather than kind of picking and choosing our fights.
Absolutely. I completely agree. And I think that she's a really great messenger for that. And the work that she's doing in her community is being replicated throughout the country, I know, by a lot of other people, but she's really leading that and being a leading voice on it. And she has a really important and influential platform that she uses to do that with. So I really appreciate her coming on the show. She's welcome back anytime. We loved having her, and it was a really cool conversation.
Mm-hmm.
But, we're reaching towards the end of that episode. It's been a day, been a week maybe. It's a Tuesday, when this comes out. But every day is a day that we need a little bit of beef. John's on a vegan diet, so we're rebranding this a little bit as Impossible Beef with Big John.
This week's beef is pretty simple, Chuck. We recently joined TikTok, okay?
Yeah, much to my chagrin.
Yes. We've been getting some followers, which is really cool. People are liking some of the stuff. But what I'm not liking about TikTok, Chuck, is all the damn stereotypical crap. There are so many people that push Appalachian stereotypes.
I don't know if you heard, but Heidi just grunted in the background, so she agrees.
Heidi hates this. Big Dog hates this. Look at Big Dog. Look, Big Dog, I know you're upset.
Fucking hates it. Just
look at this.
She can't even sit anymore. She's like,
ready for the... All right.
We're done.
Big Dog is ready to take on these stereotypes with Big John. Makes sense. Look, there are videos that are produced all over TikTok. Yeah, that's right. Big Dog, Big John. Makes sense. Got it.
You just gotta ignore her. She's just gonna fuck around. That's just what she does.
I don't care. It's great. On TikTok, all these videos are being produced, and I keep noticing that some of the ones that are like tagged Appalachian is that they're just stereotypical content that continues to push all the things that we continue to fight against. And not only that, Chuck, but I don't know if you've noticed, TikTok is, in my opinion, worse than YouTube when it comes to comments.
God.
I think the comments on there are, first off, most of them, not most, but a lot of them are disgusting. And a lot of the disgusting ones tend to be people who are trying to push back against what we're saying by trying to argue stereotypical things that continue to be pushed by, different media outlets or narratives or whatever. And it's people who don't actually understand the region. And we've said this over and over again. But my point is, and the reason I want to bring this up is there are a lot of kids on TikTok, and there are a lot of Appalachian kids on TikTok. And so when they see that, it's going to continue down the same road that we were on. So you and I, we faced a lot of the stuff face to face, but they're facing it all over the internet. It's even, but growing up Appalachian is really tough right now too. This is only going to make it worse. It's going to make people, if you thought code switching was bad, I think it's going to get even worse than that. If we continue to not fight back against what's going on TikTok and really start to say, we're not only controlling our narrative on Twitter and everywhere else, we're taking it back on TikTok too.
Taking it back on TikTok. We're ticked-tocked off about it.
We're ticked-tocked off, and we're ready to take over.
Loaded to bear. Okay, well, then we're going to try to do it. It's pretty easy to go viral.
But there are
nowadays,
a lot of people doing it.
We'll figure it out.
But there are people doing it. We're gonna keep pushing our same stories. There's people like Danielle Kirk who has, she's done a lot for the region on TikTok. I think that's great. It's somebody that we're going to have on the show eventually.
Of the show, yes.
So there are people on there that are fighting the good fight. I just think we need to make it known now, Chuck, before we take over TikTok. Okay, before our eventual takeover, we need to let people know that this is why.
Go there. You heard it first, right here from the horse's mouth of the Impossible Beef, the Impossible Horse's mouth. Don't eat that meat though, because it's horse meat. I don't know where I'm going. Thank you for that. Rallying the troops, very important, especially the ones that failed the physical fitness test. Love to see it. Yep, we're gonna be on there. We're gonna be doing our thing. We're gonna be pushing back against the bullshit because that's what we do here on Appalachia. Thank you all so much for listening. Join us online at appalachia.com. Follow us on all the social medias, including TikTok, Instagram, Snapchat, Friendster, Zanga.
Visit our store,
TeePublic. It's in the Linktree link. You'll find it. I'll put it in the show notes.
TeePublic.com/Appalachia even.
Shit, there you go. That's right. Yep, you can buy a shirt there to support us. And support yourself by clothing yourself. We love to see it. Love to see it. Don't love to see people naked, at least not in that context. Thank you for listening. Have a wonderful week, and good night.